Folks, welcome back to another episode of the IMGPH podcast. Welcome to the world of math and economics. Yes, you heard it right. Usually we bring up biostatistics on the podcast quite often, but really what we are bringing up today are people that have connected within the NYU community because of math and economics and just having a love for numbers and applying that into public health. We have Kofi Agyabeng and Fred Lei, and we're going to be learning about their journey, how they got into public health, and for those of you that are interested in math and are starting with math, probably this is an interesting episode for all of you. Kofi and Fred, welcome to the podcast.
Thank you.
Thank you.
I have to start by saying that usually the people I meet in public health, they have a love for public health, and then biostatistics and the numbers come into their world because they realize it doesn't function that way. At least from what I've read about the two of you, it's been quite the opposite, that you're currently doing your master's in economics and you're doing your PhD in biostatistics here at public health. How did you start with math and then go into public health? What are your individual public health journeys?
So basically, I would say my public health journey wasn't that certain because back in Ghana, at the secondary school level, you have to pick a track. In my school, we had 3 tracks. That's the general arts, which is kind of liberal art. Then we have the science and we have the business track. I didn't want to do anything related to health, so I didn't choose science. So I went into business because I was interested in business then. So there I had to do courses like economics, accounting, management, elective math. Then I fell in love with economics because it was so real to our daily life activities. So I decided to do economics at the university level. Then I got to the university, I had to do 2 courses in addition to the economics, which is statistics and math. Then along the way, I decided to drop statistics and just concentrate on economics. Then one of my professors said, no, if you want to be an econometrician, you need statistics. So I just proceeded.
What is an econometrician?
That is a combination. So it's just like applying statistics in economics.
Oh, okay. Gotcha.
So if you apply statistics in medical field, that is biostatistics.
Oh, okay. Sorry, keep going.
So then I decided to do a combined major in economics and statistics. So after that, I had to do a national service, which is a 1-year program. So that was where my turning point came in. So I got posted to University of Ghana School of Public Health. So at that place, I was assigned to the biostatistics department. And that was my first time dealing with biostatistics stuff. So because it's a public health institution, you have to learn all the language, all the skill. You have to just switch all your statistics and math knowledge into public health. So that was where I got introduced to it. And the funny thing was that because I was involved in a lot of projects, I realized that, I could actually learn more about people's health through data without even going to the health facility. So that was the turning point for me to move into public health.
One would almost feel like I want to avoid public service at all costs, and public service gave you your path.
Yeah.
In a way, public service showed you public health, and I never heard it that way, even though that makes sense, that biostatistics is statistic but associated with medicine. And I don't know why that didn't ever click for me till today. Amazing journey.
Yeah.
What about you, Fred?
I think I came from like a pretty similar background to where Kofi came from, where like I chose to study economics and math starting off in university, and I sort of realized somewhere along that line that like what I was really interested in regards to like the field of economics was like the whole aspect of like econometrics, right? Like applying statistics and like just like I don't know. I just think that like being able to derive insights about how the world around us like works or functions from like data is something that just like feels like really rewarding and really cool to me, you know? And so like, okay, like to be honest, like at this time last year, I had absolutely zero idea about anything public health related.
Wow.
Yeah. But like I just saw like honestly, like I saw like a cool like a research assistant posting like on Handshake for Alex Dahlen and his like and like a research project that he was looking to do involving opioids that I thought seemed pretty interesting to work on, and like I just applied for it and like that's how I got into like got my foot in the door, I guess. But yeah, like I think that since then, I realized that like in many ways, like the fields of public health and economics are like honestly quite similar. You know, like in the sense that like for like any sort of like public health policy implementation, right, or like any type of like policy analysis that you want to do within like the space of public health. I mean, of course, one thing is actually implementing that policy, right? But like the other thing is like looking to assess, hey, is this policy doing what we expect it to do, right? Or is this policy like effective, or is it like the best way for us to be able to like use our scarce time and resources? You know, is this something that we should be pursuing, right? And I think that those are all fundamentally economic questions, you know. So like I think like that's maybe sort of also sort of going into like the question of like where our skill set as like economists or like mathematicians like come in. It's being able to answer those questions using like the data sets that people like provide for us on like the efficacy of these like implementation programs or so on and so forth, you know. Like I think being able to answer those questions, number one, to me at least, it feels like it feels like a very rewarding thing to do. But also, like I think it's necessary in a sense to be able to like actually implement things that look to help the most people or are like the best use of our time and like the resources that we have available. Yeah.
Fascinating how 1 year ago, no public health, and now it's pretty much your daily life, I would say.
Pretty much, yeah.
The numbers are almost a superpower, it seems, in this world. Numbers are essential. It feels like a very human-oriented industry, which it is, but the numbers are influencing decisions and understanding of concepts, and you are the translator for numbers, the two of you, it seems like. Even though I'm so tempted to get into biostatistics, and we can leave that at the end, what I'm most interested in is that you both are coming from different schools, but same interests. How did the two of you connect?
Yeah, so like the two of us just happened to like connect honestly by random chance. Like it was that like aforementioned like research assistantship that I mentioned earlier with Professor Dahlen here at the School of Global Public Health. He essentially was looking to hire like a group of like statisticians to help out on like a project looking to analyze just like changes in like opioid overdose mortality. And yeah, so both of us happened just to get signed on for that project, and that's how we met, and we continued working together for that project and over the summer as well as part of his biostatistical collaboration and consulting core. But yeah, I think that's how we first met.
Yeah, what was your side of it, Kofi? How did you end up on the project?
So actually, I work with Dr. Dahlen directly. He is my academic advisor. So
okay.
So I happened to he mentioned it to me, and I said, okay, that's good. I mean, it's an interesting project to explore, and also given the fact that I haven't been in this is my first time being in the US, I think I saw that as an opportunity to learn more about the US, the drug issues in the US, and how things are turning out to be. So that was one of the interests. And as a public health person, I mean, you're also interested in promoting healthy life and also helping to prevent diseases and other stuff in the system. So I saw it as, okay, this is an opportunity to contribute at a larger scale. So that was how I also expressed my interest in the project, and gladly I met Fred on it. I was like, okay, let's go on.
I would almost say it's so challenging to find your tribe is the word that's coming up, or people that align on a project or in work, and it seems to have just happened to you. Or did you do more than that to get into a situation like this? How do these things work for people to get their direction and connect with other like-minded people at NYU?
Okay, so for me, I feel like working in a collaborative lab requires you to be a bit tolerant because you are working with people from different backgrounds. And for you to be effective and to achieve one, because you have only one goal, is to finish the work and also help each other develop. Now, one thing that I realized was that if you are coming from different backgrounds, you may have similar ideas, but from different perspectives. So how you may approach things might be different from the other person, but the end goal is the same. So you have to be open to be able to learn and to identify things that is needed. Because, for instance, working with Fred, there was another colleague of ours who was also on the same project. One thing we realized was that, okay, I may know something which Fred might not have an idea about it. I explained to him, okay, he gets it. He may also know something and explain it to us. Once we agree on this concept and realize that that is correct, there is no way to go back and forth with it. You just have to be open to accept people's opinion or ideas about what they think about how things should be done and what needs to be done. Otherwise, it makes the work very difficult. But this collaborative work exposes you to that and you get to learn from that as well.
I love the idea that everyone wants the same outcome. That's the core of everything, of the way you mentioned that everyone wants the same outcome. I feel like you're nodding your head immediately. Is it something to add based on that?
Yeah. No, of course. Yeah, just like, piggybacking a bit off like what Kofi said about collaborating, right? Like, I don't think it's necessarily about like being in like the same like tribe per se, because of course we obviously come from different backgrounds, we have different skill sets, we have different experiences, so on and so forth. But like I think that's like the beauty of being able to work in like a team environment together, in that like you have like the combined or the potential, right, to use like to combine knowledge and expertise and skill sets of like multiple different people, right? And doing so will like get you a lot further than like, if done right, of course, than like if you're just working on that thing yourself. So yeah, I think that's like that ties into like what Kofi was talking about in regards to like the importance of being like open-minded and understanding that like, okay, people have different opinions on things, people have different skill sets, right? Like like you might know something that he doesn't, he might know something that I don't, and just like being open-minded and willing to like learn and take in information, especially as someone with like little prior public health experience before this, right? Like I feel like I had to do like a lot of learning on the spot, about like best practices in research and methodology and so on and so forth. And yeah, I think that Kofi and of course Professor Dahlen and all the other researchers that I had the privilege of working with like over the past few months really helped out with that. And yeah, I think that's the beauty of working in a team environment. Yeah.
Love this. Okay. I would love to dive deeper into this project. So tell me about the project, a day in the life. What kind of work do you do? Let's get a glimpse of the world of a biostatistician and what it's like to collaborate on this on a day-to-day basis. So give us a quick summary of what this project is about. What are you solving for? What are you trying to investigate? And then what's a day-to-day like for the two of you?
I guess like just like as like a bit of like background, right? So like it was like a sort of like a joint project that we're working on between the School of Global Public Health and certain federal officials in the federal government that were involved in like drug enforcement and tackling like the ongoing drug epidemic like within the United States. And essentially, like I believe what happened was that what like they noticed in their like data was that it's like good news actually, but like they noticed that over like the past like year and a half or so, drug overdoses have been like declining precipitously across the United States, and like they were of course trying to figure out like potentially like why that's happening. Of course, maybe to like be able to like replicate it, like in the future, because it's amazing news, And yeah, so like essentially like we were signed on essentially to try to figure out potential reasons as to why this decline was happening. And I think just based off of like available data and time constraints and whatever, like the factor, I guess, because of course the drug epidemic has like 10,000 different reasons, right? But like the one that we chose to focus on was in regards to drug supply and drug supply potency, and like in particular we wanted to look at whether or not like there were changes in the amount of fentanyl in the drug supply, and whether or not that was associated or correlated with that decline that we were seeing in the data. Right. So so like essentially it was just looking into like drug supply factors, right? Drug supply lethality, right? How much and specifically in regards to like fentanyl, how much fentanyl was in the drug supply and how that related to things.
This is awesome. I mean, so it's like something has happened and then you're using your skills to investigate what went right and how we could replicate that and keep it going. So my question is, how do you do that?
That is where our work comes in. I mean, so I think Dr. Dahlen was contacted and through his BC3 lab, and so he being a statistician, so he gathered us to be part of the team, and our work was to use the available data to investigate this or answer this research question. So what we did was that, okay, what are the available data set? We realized we have information about drug overdose death through CDC Wonder, and we have information about drug seizure through the Netflix, that's the National Forensic Lab, forgetting the full name, but that is Netflix. Yeah, so they have information about drug seizure and which drug has, which of the seizures had fentanyl as part of it, because our focus was on fentanyl supply. So we had these two data sets. Even though we had other data sets, we didn't, because of the data completeness and the kind of I think how the data was organized, we couldn't rely on them. So our focus was mainly on these two data sets, that is the data from CDC Wonder and the Netflix data. So we have data on overdose death or overdose mortality, and we have data on the drug seizure through the Netflix database. So those are the two data sets that we basically worked with. And so as part of it, we had to define our outcomes and our exposures. So in this particular study, the main outcome was drug overdose death, which we use. So the definition was basically people who died as a result of drug overdose, which we have indicators in the CDC Wonder data set that we use to do that based on the ICD-10 code.
ICD-10?
Yeah, that is, I think, international
cause of, or is it intentional cause of death, I think?
No, so there's a medical code that they use to classify diseases.
Okay, got you.
Yeah, so that is, so we have indicators that we use to identify which death is coming from drug overdose death and which one is not. And even with a drug overdose death, we looked at three different types. We have the synthetic opioid death, then we have all drug overdose death, and we had non-synthetic opioid overdose death. So those were the three main deaths that we were looking at. Two of the deaths were used as sensitivity analysis, then as we focus on the overdose death, opioid overdose death itself. So then we come to the exposure. the data set is in such a way that when there is a seizure or drug seizure, they send samples to nearby labs within the state to test to find out which how do you call it, chemicals are available, are present in the substance that they've seized. So each drug that has fentanyl, they indicate that, okay, we found this, and these substances in them. We have different types of fentanyls. I may not be able to state the specific ones,
okay.
but we just found out, okay, so which of these chemicals can be classified under fentanyl stuff. So we found that, and we estimated, okay, so what proportion of the drugs that were seized had fentanyl in it. So that became our exposure. Then we had to do the modeling to see how these trend of the exposure, the proportion of fentanyl in illicit drugs that we seize is associated with the trend that we see in the opioid overdose death over the period.
And this seems to be like a lot of numbers are managed from each of these data sets, and your job is to make sense and collect all the data sets together.
Like just to like add on, I guess, like I think that a lot of this process is really like putting together like a puzzle, you know, especially working in like drug research and drug analysis. Like you find out pretty quickly that you are limited pretty much solely by just like the amount of data that you're able to collect on things, you know, right? So like it's sort of like or like the research process sort of boils down to, okay, this is the data that we have. What can we possibly do with it, you know? And yeah, like a lot of it is working around these like limitations and trying to like sort of like squeeze whatever we can out of like the data sets that we can. And yeah, and like in that sense, it is quite a lot like a puzzle sometimes, you know, and like that's what I find intriguing about it, at least. Yeah.
Like how NYU has keeps you motivated to, this is like a daily thing, and it seems like both of you are still affiliated with NYU, and that's a big part of your life. How does NYU keep you motivated to deliver on such heavy projects and keep you going in this world?
Okay, so I think one thing that I always go by is that everyone can do whatever you do, but when you are given the opportunity, that is when you can shine. I feel like without NYU, you wouldn't be in a position to work with ONDCP, because you can't go in your persona to go and work with them. But this is an avenue that was created by NYU. Nice. So I feel like NYU is giving you the platform to work on the global scale, at the national scale. And that is one thing that every student may want to be associated with. So you know that, if I'm going to this institution, I have the opportunity, I will get enough exposure that I can leverage on after school to work with people on the global scale, on the national scale, and also contribute. It's not just about working to get the money, but you seeing yourself out there like contributing to the national development, solving problems. Wow. Daily problems is one thing that keeps you going.
And the change is happening. That's so beautiful. I mean, You're essentially saying you got the launch pad to go to the next level, and it seems to be the similar answer for you as well.
I think that it really comes down to just like the opportunities that NYU provides, and like the projects that are like affiliated with the school. And like pretty much like just like as Kofi said, right, like the whole reason why we even do this in the first place is because Professor Dahlen was able to get in had contacts with the ONDCP like at the White House, and they were interested in something, and they came to us, you know, right? Like they came to NYU to help them out, you know. And it's like these kinds of opportunities like that like honestly are probably like only really available here, you know, right? Like that provide these like sort of like interesting questions to answer and like interesting projects to work on that really keep us motivated.
Yeah, just a little bit to what you mentioned. So The other thing also has to do with the leader of the team. And I feel like Professor Dahlen is someone who gives you the opportunity to explore. You are not afraid to make errors. You are just, what do you think? How should we approach this? It gives you the room to explore, to train yourself, to give suggestions. How do you put yourself out there for people? How do you learn from each other? Because we can be in meetings and we're like, okay, he will not even talk first. Like, what do you think? There's no bad answer. There's no good answer. We all just share ideas. And I feel like that is a kind of opportunity that helps students to develop and be confident of themselves.
Speaking of students, if there's someone watching right now that is interested in economics, statistics, biostatistics, maybe the future generation, you two are doing some amazing work. You're solving big problems, and I think that we have even only scratched the surface of one project of the many projects the two of you are working on. That person right now, maybe the 18-year-old, even a 30-year-old, or even a 40-year-old that's out there that's like, I have this skill. There's a place in public health to apply it. What would you share with them?
I would say to go for it, yeah, because like I think that like, as much as, you know, like going back to what I said earlier, maybe, right? Like, as much as like implementation is a part of public health, an important part of public health, right? Like, analysis is also, right, like a critical part, and not only that, but it's a rewarding part, you know. I think that especially with you know working in or like having training as an economist or like a mathematician, right? I would say that like you have the opportunity, like in public health, to really impact people's lives, like for, you know, like for the better, right? In the sense that like you have the opportunity to like assist in like implementation. You have the you know, like you have the opportunity to work on policy analysis and see like you know, like which policies are working, what can we do to make things better, you know, like, yeah, just like what can we improve on in general. And I think that, to me at least, that was a process that I thought was very, very rewarding personally. So yeah, like to like anyone who maybe has like a background or interest in economics and mathematics who wants to go into public health, I say go for it.
Yeah, I think public health is an interdisciplinary field, and I feel like no one is an alien. Just bring your skill on, and you obviously find a way to apply it, and you help solve public health problems. So I feel like no matter your background, you still find a place in public health.
It seems like this is an important world, biostatistics, and the impact you two are having with your work and other biostatisticians are. How can someone who has no experience at all with biostats get acquainted with it? What are some where are some places you could guide them?
Okay, so biostats, I feel like, okay, depending on your background, the starting point depends on your background. If you are coming from a math background, it's easy to flow because you just need to understand the principles that guides public health, being grounded in epidemiology, because every data you see has a data generating process, and you need to understand how the data was generated before you start analyzing it, because when you look at the data, it's just numbers, but you have to put meaning to the numbers, and those epidemiology is what is going to guide your choice of things you present. You don't present certain information for certain study design. So for instance, if you are doing a cross-sectional study, the information you present is different from when you are doing a longitudinal study. But if you are just looking at the numbers, they will probably be the same values, but they communicate to different things.
Yeah, definitely.
It's just like saying prevalence and incidence. The values may be the same, but they communicate different things. So you have to understand the data generating process, the design that resulted in the data, that is, you get it through epidemiology. Now, depending on the area you want to apply it, we have different sections in public health. We have policy, we have social and behavioral, we have reproductive health and all. You need to also understand the subject matter, because whatever you need to communicate should be relevant to the area. Then, before you come to the numbers itself, so then the statistics and all those things, you learn them as you come along. Yeah. Okay, so I think those are.
It almost seems like
It
almost seems like they need to take a class.
Yeah, you need to. I think
understand it, because
you need to understand what you are going to do. You can't just jump in, because it's kind of. We have housekeeping rules.
There's a certain decorum to maintain.
Yes, there's a culture that needs to be followed. I mean, you can't just jump and say, okay, I know math, I know how to calculate this, so this is it.
It's understanding the math.
Yeah,
it's like I speak English, but how you use the English also matters.
Good.
In the same way with numbers.
Just as we have formal language and we have informal language.
We have numeric language.
Yeah.
As well. Love. And is there anything that you would share with someone, Fred, on I have zero experience. I want to make an impact, and I want to start with biostatistics.
Yeah, no, I think like as Kofi said, it does come down a bit to learning the law of the land. But like how you do that, of course, is just like find right. Like once you have like an interest in like a subject, I feel like the desire to learn and the desire to like know the law of the land and to do better sort of like flows naturally from that. So I think maybe like the first step, I guess, is just to get some exposure to like the types of work and like the wide body of work that is being done in regards to biostatistics or to public health, right? And hopefully like once you like get familiar with that, like you'll see, there's some really interesting and meaningful questions being answered here. And like from then, like, your desire to learn more will come from that,
Find the mission and the desire to solve the problem will come. So biostatistics is a way to get there. And it seems like to understand the decorum and to follow the structure, you need to understand the principles, and then everything will effortlessly work together at that point. Well, that's amazing. We're almost at time, and I want to say you two are doing some amazing work. I learned a lot today about the world that you both are in, and can't wait to see all the amazing projects you work on and achieve down the line.
Yeah, of course. Yeah, thank you. Appreciate it.
Yeah.
Folks, that's Fred and Kofi. We'll have their stuff. You can always look them up online as well. This is being shot in 2025 in December. So who knows where they are by the time you're watching this episode. This might be 2 years later, but I'm sure they're doing great things out there. Thank you both for being on the episode.
Thank you, of
Thank
course.
you
Yeah.
for hosting us.
Take care, everyone. We'll see you in the next one.